healthcare is actually wherever the patient is, and most of the patients live outside the hospital. So it's a mindset change also for the hospitals, which has started now through telemedicine. They can cater to a larger mass than only the beds what they cater to.
Welcome to the BlueCircle, and thank you very much for joining. It's such a big privilege and a pleasure to reconnect with everyone, our distinguished panelists who are handpicked because of the think input and the rich experience they bring in. And thank you to our distinguished audience for joining us. We've received over 150 registrations, and 90% of whom are CEOs and CXOs. Many of them are repeat visitors to our webinars, so which is very encouraging and motivates us to even provide higher levels of dialogues through the online channels as well. For those of you who are new with us today, the BlueCircle is an ecosystem to help leaders manage disruptive times and become future ready. We focus on the 4 fundamental sectors, which are healthcare, energy, e-mobility, real estate, and infra. We also present socio-economic insights which ultimately determine the evolving complexion of the market. In response to the COVID challenge, the BlueCircle also has accentuated its digital presence. One of the many modes we employ is our weekly webinar series, our active digital publication. We're also building a handpicked domain-focused expert pool drawn from within our community, from our member base and its associates that will guide businesses during and post-COVID in these 4 sectors. In addition to this, and you would be happy to know, and well, many of our members are already aware of this, we are soon launching a digital platform for leaders, the LinkedIn for Leaders, wherein we will present to them the opportunity of connecting with people just like them, also house highly curated quality content and meaningful conversations on the platform. So those leaders among you who are interested to join in, please do write to us. And the topic for today's session is Rise in Telehealth. The discussion will revolve around the headwinds and tailwinds which telehealth faced pre-COVID, the triggers which have sparked its phenomenal growth post-COVID, and the shape of things to come in the future. We've invited prominent practitioners and thought leaders from the sector, and now in the best interest of time, I will just quickly mention their respective names and designations. We have with us Mr. Amit Munjal, founder and CEO, Dr. Insta; Ms. Geetha Manjunath, PhD, founder and CEO, Niramai; Dr. Satish P, Rath, Chief Innovation and Research Officer, Aster DM Healthcare. And the moderator for the session is Mr. Pavan Choudary, best-selling author, CEO of French multinational Vigon India, Chairman, Medical Technology Association of India, and sits on several boards across the country. Welcome, sirs and ma'am, to the discussions today, and thank you for joining us. Also, kindly note that we will have Q&A towards the end of the session. And while some of you have shared excellent questions, they are now with the moderator. And now I request Mr. Choudary to please begin the session, sir.
Thank you very much, Siddharth, and it's a big pleasure to be with you all with this enlightened panel, as well as distinguished audience like always. And so great, big pleasure. I've received some very good questions from distinguished audience, and I will try to weave them in our talk track. And if there is anything left, then I would also try to include it towards the end of the session. So coming to the topic, the rise of telehealth. So first of all, let us break this word telehealth down, because telehealth means not only distance healthcare in the clinical space, but also non-clinical interventions. So let us stick to, for reasons of manageability, telemedicine, which is the diagnosis, treatment, and prevention of diseases or injuries, and education and research provided at a distance. So it is the natural evolution of healthcare in the digital world. However, why did it not evolve so fast yet till COVID came? This is the first issue which we'd like to discuss, and I will invite Dr. Geetha Manjunath. Geetha, what was keeping telehealth? What was restraining it?
Yeah, thanks, Pavan, and great to be part of this session. And thanks for including me in the panel. Yeah, so basically, I feel there are three main reasons and challenges that was obstructing, if I can use the word, to make telehealth as big as it's probably going to be in future. The first and foremost, on the patient side, there's a lot of hesitation for the patient to take advice from the doctor over phone or video or something, as opposed to a face-to-face interaction. We always talk about what that humane interaction, the trust that's needed in adhering to the address, adhering to the prescriptions and messaging that the doctor gives. That trust element between the patient and the doctor. And because of that, the patients have to sort of start using it and so on. So there was some, reservations there, and people were more comfortable going in and meeting face to face. And I think that has changed now. COVID has made it more inevitable that, they try to do as much as possible from home, including their especially non-COVID care happening right out of their home. And telehealth is a beautiful, platform or a mechanism to actually get that done. The second big thing is, as a technologist, right, I would like to sort of look at what are the things that were lacking in the technology framework. So one, the sensor end, are we able to understand, are the doctors able to understand the patient, let's say, vital signs or any other type of, quantitative information that they wanted to know, so that the prescription or the diagnosis is more accurate. So the point of care devices being used by the end users and availability of these devices to be on medical grade, if I can say that, was one thing. Then the transmission itself being more private and making sure that the data security layer is there. There is enough bandwidth to make the video conference look like what we are doing right now, rather than something that's a lot of shaky gaps and so on. So suddenly you start feeling the personalized nature of it goes for a toss. And then finally on the cloud side, right? So how do we have a secure way of saving the information? If the doctor wants to relook at the previous session, they have the same patient. How do we do this? How does the doctor himself or herself access the infrastructure? And same at the patient end. So all of these sort of the technological piece, is also gotten accelerated. While it has developed over years, now being put into use, there is more, less hurdles, I would say, and more adoption possible. And finally, at the doctor's end, right, the process aspect of it. How does telehealth patient picture in the list of huge line of OPD patients that they were addressing before? So that also, thankfully, I guess, are not due to COVID, there is a reduction in the OPD. And so there is hopefully more time for the doctor to weave in these telehealth patients as well and fit into their schedule. And of course, there are a few of the technological trust elements, even at the doctor end. Is the doctor really speaking, or is somebody else talking instead of them? So there are some of those challenges yet to be addressed. But I think infrastructure-wise, and especially the trust-wise and adoption-wise, I think we really see a difference in adoption, huge level of increase in adoption, the trigger being COVID.
Yeah. So you feel that the obstacles were trust and acceptance by the patient as well as by the doctor, the technology and infrastructure which was lacking, and privacy and some process issues. Great points. So coming to the fact that COVID has unleashed telemedicine, what do you think are the reasons, Dr. Satish, why telemedicine has got such a big impetus through COVID? How is it helping the patient and the doctor?
So first of all, thanks to BlueCircle and especially Mr. Pavan for having me in the panel. That's a great question. So I think what COVID did with 20 years of persuasion from both technology and telemedicine, let's say practitioners could not do, because it would made telemedicine as the only way to experience health, or let's say healthcare from a distance, or healthcare from a non-urgent care settings, and healthcare from the aftercare setting. Why telehealth took so long to get adopted? Maybe, I can say that, it used to be a tech push. So it was the technology which was available for video conferencing and consulting over a distance. And few sensors were also there so that, we can have the history, can have the diagnosis for non-urgent cases or non-acute cases. But somewhere that comfort, or that you can say that inertia, was always there in the healthcare system as well as the regulators, that we are already busy with what we are doing, and this is not something which is so important for us to get into. Due to COVID, what happened is there was a double whammy, or there was a double-edged sword of how COVID attacked the healthcare system. For COVID, people who were infected were to be quarantined, so they cannot go to a crowded setting or a physical consultation where the doctor or the healthcare worker were also susceptible for the treatment. So I think, consultation which is non-contact was very, very important. So that was a very important or essential thing to have COVID consultation. And because COVID, the usual hospitals became the centers of COVID care. So normal patients who were non-acute, stopped going to the hospitals in fear of getting COVID or getting contacted by COVID. So all of a sudden, chronic managements, second opinions, taking normal consultation like vaccinations, let's say taking consultation like, will be doing the refill of the medicines, or I'll be doing few consultations like where privacy was very important, like mental health or sexual health, which, Dr. Insta is also working on. So these things came to the forefront, which were always there as an essentiality, but now they have become more of a necessity. So the healthcare systems to survive now, which are going through a lot of problems because, OPD footfalls have come down, elective surgeries have come down. So they are now looking this as a survival modality to, survive in the system. So if they adopt telehealth, they can cater to the COVID quarantine patients without exposing the healthcare workers. But most important, they can only take care of the chronic care patients, which are 80% of our cases, if they can manage it through telehealth. So in some way, I think, COVID has made the world upside down, but in some way it has done also good by exposing the gaps in the healthcare system, where healthcare system, which was tertiary care or sick care, was considered as the only way healthcare was done. Preventive care and aftercare was somewhere, obliterated from the normal healthcare. Now this has made telehealth as a possibility. That's where we are seeing most of the digital health companies making very good growth.
Yeah, so I think you've highlighted a very interesting point. You have alluded to the conservatism in the profession, that is also reflected through the slow or glacial pace of healthcare reform, where healthcare reform is spoken of as a renovator's delight. You cannot change much; you have to just add small pieces. And shifts in mental models do not happen so fast. And COVID has perhaps been that trigger, which has brought in the fear of the infection as the guiding force to bring in telehealth. Of course, the other advantages which will come through that telehealth adoption or telemedicine adoption are reduced travel expenses. It will save time. It will save maybe medical cost, less disruption of the work schedule of the patient, and greenhouse emissions, they are saying it will save. And another important point is doctor behavior. So many a time we are finding that, research finds that there are cohorts, there are people, millions of people now who only like to interact with technology. They don't want to interact with people because interaction with people is stressful. And sometimes interaction with doctors or medical facilities can also be stressful. So that also is another advantage. Plus the stigmatized indications like sexologies or psychiatric consultations or alcoholism, etc., also can be easily dealt with through telemedicine without exposing yourself or your car, etc., to people who can know that you are taking consultations for such things. Also, accuracy, they are saying. White coat hypertension, which happens when you are taking blood pressure of the patient in the white coat with a mask and all, that can also be another unintended benefit of telemedicine. Coming to Amit. Amit, what do you think are the are the advantages for the doctor from telemedicine?
I think the advantages from the doctor's perspective for telemedicine, let me put it this way. I think keeping everything else constant, going to a doctor's clinic and getting yourself checked has no close substitute. What telemedicine makes beneficial for the doctor and the patient is that many a times patients end up kicking the can down the road and saying that, oh, maybe this will go away by itself, apne aap theek ho jayega. Or many a times, because of paucity of time, many patients end up self-medicating. So telemedicine comes handy. Why? Because now patients don't have to worry about wasting 3 to 4 hours of time going to a clinic, dealing with the parking ordeals, navigating through bumper to bumper traffic, waiting in the waiting room of the doctor. Doctor can do the consultation then and there via telemedicine and provide a right resolution for the patient. The other great advantage for a doctor is that a typical catchment area for these doctors who are primarily physicians or general medical practitioners or dermatologists or pediatricians, which means that they are not in invasive procedure categories. They are not surgeons. The typical catchment area for these doctors is what? 10, 15 kilometers? Nobody goes beyond 15, 20 kilometers, let's say, in a worst case, to go see a primary care physician. With telemedicine, now the whole country becomes your catchment area. Anyone from Kashmir to Kanyakumari or from Assam to Assam to Ahmedabad could now tap at the app and visit the doctor virtually. So those friction points are long gone. The other advantage is for certain discrete practice areas that you also alluded to earlier, like psychiatry, psychology, sexology, where the social stigma across the world is high, and more high in a country like India, where people don't want to be seen at these clinics and they choose the farthest possible doctor operating out of dark alleys of the city to go get the consultation from. So with telemedicine platforms like Dr. Insta, you don't have to worry about log kya kahenge, what if my car is seen outside the sexologist's clinic, or if I'm consulting a psychiatrist, people would call me crazy. So all those behavioral fears could be put on the back burner, and you can do these consults from the privacy of your own home or office, and then take it from there.
Yeah.
Financially speaking, for the doctors, it's a great time saver. If you're a hospitalist or running your own clinic, the revenue that you can generate for yourself still comes out to be the same, which means that your rate per hour actually improves. Why? Because in the past, if you're working in a hospital, first of all, you are at the whim and the mercy of the hospital roster as to whether you're given a day shift or a graveyard shift. And now you can manage your own schedule. You can say, okay, I'm going to operate from this time to this time, and you take it from there. So you become the boss of your own calendar, and no hospital dictates your schedule. Also, if you're running your own clinic, there are a lot of fixed costs involved in terms of real estate, other infrastructural costs. Whereas if you're a telemedicine practitioner, you can cut the cord on those costs. So it's all variable now. You can dedicate one small area, study, or private niche in your own home and start doing the consults and make the same amount of revenue that you were making as a hospitalist or as someone who was running his own clinic in any bigger city. Yeah. So these are some of the tangible and intangible advantages of practicing telemedicine. You clearly save on commute time as a doctor going to a hospital in most big cities like Delhi, Mumbai, Bangalore, etc. you end up wasting 2 hours of your
Correct.
time, and now you can dedicate those 2 hours to practicing and seeing your patients.
Yeah.
So these are at a very high level the advantages of telemedicine that come to the fore for the doctors.
Yeah. Also, the allied points which emerge from here are the missed appointments. Sometimes patients don't turn up, cancellations. Waiting room pressure is a big problem which doctors face, where they are waiting, and just as doctors can be difficult at times, patients can also be difficult. They can insist that why have I to wait and so on. And the other point which you brought in from the provider perspective can be added to triaging. To make sure that you only get those people in your precincts who are really needing critical care, and you filter out the rest through telemedicine. Any other point you would like to add from a doctor's perspective, Dr. Satish, which goes in favor of telemedicine practice?
So definitely, I think in addition to what all Amit said, it takes away the wait time. And if telemedicine is used in the proper way, let's say, especially for follow-up or let's say for secondary opinion, a doctor can actually save time. So if I'm a doctor and then, the patient is coming to me for a consultation, through telemedicine platform, I can know actually for what complaint this person is coming from, or if I can stitch all the past records, it can also give me some prescriptive analytics that, this person might have come for this kind of a condition. So this improves the accuracy of diagnosis, as well as this improves the time wait period for this, as well as what we call as the cognitive load of a doctor. So unless in a physical consultation before the patient enters to the room, I'm not aware much about, what this patient is about and what he is going to talk and everything. Whereas all these things can be shown to me in my telemedicine platform. This person is an old diabetic, having alcoholism as a problem, with a comorbid, hypertension condition, with smoking and this and that. So I can be prepared well, save that time for my diagnosis. Second point is telemedicine, or let's say, digital medicine, if we can say like that, can also help in a lot of automation in suggesting me what can be the follow-up sequence for this, what can be the possible outcome of this, if we have the existing, let's say, availability of those parameters with me. And third thing is with invention of a lot of new sensors, as the patient is talking with me, I can know the mental condition of the patient. We have also technology where we can, which we worked in Xerox, as we can know about the vital parameters of the patient as the patient is actually presenting to me, or what is the, other parameters of the person. So it has got a lot of advantages for as a doctor. But, alluding to your, initial question, why there has been such a late adoption of technology or telehealth for the healthcare practitioners. If I wear the hat as a doctor, I think telemedicine has been very heavy on the tele side or the technology side. But, let's say a typical consultation can be broken down into taking history, doing the diagnosis, and then doing a prescription. There is very little automation which has happened in these three fields. So till the patient has the responsibility to produce the history, the doctor has still the responsibility of, let's say, writing down a digital prescription, which is very difficult. There are not enough softwares for that, as well as, doing a prescription, which is e-prescription on top of it. So let's say my wife is a doctor, but she struggles to write on a telemedicine application, and which is a challenge, and which is a challenge with so many other people. So telemedicine, to be sustainable, they have to look for automation into these three fields, which is going to be driving adoption for doctors. So automation in the history taking part, which will make, patients also feel easier. Automation in the diagnosis part, with the, let's say, doctors will find it much more easier and swifter to produce a prescription, and a digital prescription which can be acted upon. So if these three areas, I think telemedicine applications like Amit's firm or other firms are looking at, this will be increasing adoption in a much more larger way.
Excellent points. Excellent. You brought in the cognitive load. You brought in the archives, easily available and manifestable archives, through which you can decide whether the patient is allergic to a particular medicine, what is his background, what is his ethnicity, and so on. That will improve accuracy. And digital prescription, I fully agree. digital prescription system should be standardized by the government, that will empower the patient as well as reduce errors, as well as allow monitoring of the prescriptions. So great points. Coming back to Geetha. Geetha, you are an entrepreneur also, and a very, let me say, path-breaking one. What is it that you'd like to add to what Amit and Satish have said regarding the telemedicine's advantages to patient and doctors? And thereafter, I'll come to the payer when I'll go back to Dr. Satish and Amit.
Okay, thank you, Pavan, for allowing me to say, because I was very excited to hear Satish talk about a lot of data, looking at history, and there is technology support needed for the telemedicine, because that is a real plug for AI-based solutions, for example, right? So here is where we could, in future, sort of also be seeing it happening, put in artificial intelligence-based, guidance for, let's say, summarizing the history and predicting, what likely may be wrong. This can also include some of the wearable devices or a point of care devices that the patient would have used, right, before or through this process of consultation. And then also do some kind of a treatment planning or treatment suggestions. Like, for example, if you suggest this particular medicine, then this is the likelihood of that being effective, and so on and so forth. So give these as additional information for the diagnosis of the person, so that there can be more personalized, personalized medicine can also evolve. So while the teleconsultation and telemedicine, telehealth overall can be thought of as connecting the patient to the doctor, just having this platform and the evolution around it, the need that creates around it in terms of understanding what are the qualitative and quantitative parameters of the patient is, so that the diagnosis is more precise, and then reducing the time for diagnosis itself and all of the different stages that Dr. Satish mentioned will give rise to more and more innovation around these digital technologies, particularly in AI and point of care devices and automated diagnosis with doctors' review put into the picture. I think that is very exciting to me as a technologist as well, and as well as entrepreneur, because we are also trying to do, for example, cancer care, which was never ever thought of as a home care, right? It's something that at Niramai, we've been able to make it as a home screening possibility.
Yeah.
And how is that possible? Because one, of course, the device itself is portable and radiation free and so on. But because there is an AI element to it, we can, at the point of care, generate the report itself. And then, of course, it will be reviewed online or offline by a doctor to make sure that the end-to-end cancer care also can be done outside a hospital. I guess this is one of the first times that we are looking at, and such innovation we'll surely see more mushrooming around telehealth.
Absolutely. So the interface of AI, big data, IoT, etc., is going to really become the new cradle, which will catalyze telemedicine and its utility in a very big way. Coming back to Amit. Amit, how will the payer benefit through telemedicine?
Payers get benefited in multiple ways. If you look at the health insurance industry in more developed countries than India, you get to see that in countries where the marriage between telemedicine and health insurance companies, i.e. the payers, has already happened, there the number of diagnostic tests prescribed to patients generally go down. There the insurance companies are paying far less per policy holder or user than in some other countries where the marriage between telemedicine and virtual healthcare is yet to happen. But the marriage between telemedicine and health insurance is yet to happen. And that makes sense. Why? Because if you have a captive lab or a lab with which you have an entrepreneurial arrangement, then as a doctor, sometimes you have a propensity to prescribe one too many tests. So, telemedicine being more arm's length curtails that practice from get-go. The other thing is telemedicine also helps in early detection. As I was talking earlier, the tendency of people of kicking the can down the road, thinking apne aap theek ho jayega, when we all know that stitch at time prevent the other 9. So with telemedicine, because of less friction involved between the doctor and the patient consultation, patient ends up consulting the doctor, and the doctor can red flag it and prescribe certain tests, much earlier than before it is too late for the patient. So this way, you are looking at a far healthier, far happier, far longer living society where Medicare or healthcare is available at the tap of the app or the click of the mouse. The other benefit for the payer community is many of these payers also have younger population. So younger population, call it in their 20s or 30s, where the illness or the usage of health insurance won't be very, very high. Now, incidentally, it's the younger population which also experiences a higher churn rate for these payers. So if you're a 25-year-old who has taken a first health insurance plan independently and you haven't used it at all and you've still paid 20,000 rupees for that annual health insurance plan, you ask this question to yourself, hey, why am I using health insurance? I'm in the best of my health. I don't need health insurance. So next year, you may either downgrade the plan or may not even take the plan. Whereas if health insurance is giving you a tool like, telemedicine solution like Dr. Insta, in those cases, the churn rate of these people who are paying the premium and not using health insurance, i.e. the more profitable users of the more profitable customers of the health insurance companies, the retention rate of these customers would increase drastically and the churn would reduce exponentially as well. It's also proven. So because of all these benefits, you would see that all the developed countries have laid a lot of emphasis on telemedicine being a standard feature, whether it was Obamacare in US or NHS in UK or German healthcare system or Canadian healthcare system. The focus is now that we should weave in telemedicine along with the health insurance plans. And this thing is having a domino effect on developing countries like India, Southeast Asian countries, African countries, Latin American countries as well. Yeah. So net, the user would win, the countries would have higher productivity, and telemedicine would become the order of the day. Also, I think earlier you guys spoke about why it took telemedicine this long to catch up. I think telemedicine in India has a long way to go still. And I think you covered a lot of great points there. One more point that I would like to mention is smartphone accessibility in a country like India. Every single year we are seeing a triple-digit increase in smartphone penetration, which means that people can now use telemedicine from their own smartphones rather than going to a telemedicine center, which used to happen back in the day. So it's like, what happened with the cab industry. In the past, if you had to order a cab, you would have to call some centralized number and the radio dispatch taxi would come to your doorstep. Now with Ola and Uber, people have the power to dispatch the cab as and when they want, which led to a higher usage of cabs in all the countries. Same thing is happening to telemedicine, and clearly Corona, as you guys rightly mentioned, further provided a uptick to the penetration, adoption, and engagement of telemedicine in the country.
Excellent point, Amit. And we will come to the internet penetration and penetration of smartphones just in a moment when we talk about equity. But the great point which you made, and to add to it, the private health insurance industry has been heavily subsidized. And for example, this year it will have a huge windfall because elective surgeries have really reduced like anything. So it is a rich spouse, and if it will come together, as you said, in matrimony, with telemedicine, then it will become a really prudent couple, which will safeguard the interest of the payer in a very, very substantial manner. Excellent point. So coming to the other point which you raised regarding equity, how equitable is telemedicine going to be? And what are the various facets of equity, Dr. Satish?
So that's, I think, to me, the most important, question, right? I look at equity in two forms. So let's say equity for those people who are living in an inaccessible, let's say, region, either due to geography or either due to monetary, let's say, availability with them. And telemedicine can be the great platform where people can have healthcare access at a lesser cost because they don't have to pay the burden of poverty premium, because they have to travel to a city, they have to pay for the transport, they have to pay for the day's work or the labor lost for a day. So I definitely feel, telemedicine can bring in equity for people who are physically distanced or let's say who are monetarily distanced. That is part one. Second is, I think, just bringing it on the payer side. So payers have a vested interest to use telemedicine because telemedicine can be very effectively used in the preventive care. So let's say Geetha does breast cancer screening, and it's a preventive mode. So if as a payer, my patients are all screened for breast cancer or let's say any form of cancer or any form of chronic diseases, at a very early stage, I can catch them, I can control them with a less amount of money. If they are caught at a late stage, as a payer, I have to pay a lot of money. So, at the early stage, around 10 years back, we worked with ICICI to look for a risk-based premium. So what the payers are looking for is, if I can know the risk of the individual, I can actually incentivize him for the good practices. So let's say he has gone through the preventive test, he has maintained a good balanced lifestyle, he is not smoking, he is not alcoholic, he is having a good night's sleep, then maybe I can charge him less premium because he is less likely to get sick. So this is seen to be in healthcare economics a better driving force, where payer comes, they find a vested interest to keep people healthy so that they are actually ending up paying a lot more, difficult, let's say, bills, in future. Coming to equity for a country like us, which is India, where Ayushman Bharat is now started as the largest public payer kind of a system. But if Ayushman Bharat has to come into effect, the challenges what the normal hospitals are facing now, the rates or the bills or the tariffs are not sustainable for big hospitals or also, let's say, mid-sized hospitals. The tariffs are actually very, very low. So how do you involve the private capacity like the tier 2 or tier 3 or tier 4 hospitals who can actually be the provider for Ayushman Bharat, yet to be profitable? And again, their telemedicine is the only way. So they can participate through telemedicine where the cost per patient is going to be very, very less for doctors or the providers. And that is the only way how Ayushman Bharat can sustain in the long run. So people can go for all kind of screenings, all kind of preventive tests, all kind of follow-ups without spending much, as well as without burdening the payer in the long run. So I would feel as the payer and the provider come together through technology for having a good motive of providing the best preventive care for patients, this will provide the ultimate equity to all of those people, who are currently being left out from the tertiary, glazy, and glittering, big hospitals, which has done great work on tertiary care, but unfortunately not done very good work on the primary and the secondary care.
Very good point. You have shown the spotlight on economic equity, how telemedicine can really be economically equitable. Are there any other aspects of equity, Geetha? And if yes, what are they and how will telemedicine impact them?
Yeah.
Geetha.
Yeah, so thanks. This is very close to my heart, right? How do we give and how do we do the healthcare delivery in a manner that it is scalable and also it does reach the rural and the underprivileged, right? Like Dr. Satish pointed out, definitely by reducing the cost of interacting with the doctor, definitely, it does address a bit of the economic side of things. There is still the awareness and the comfort of using a smartphone. Yes, WhatsApp can be done by anybody today. It's really wonderful to see people doing, let's say, Google Pay or Paytm, right? So it's very nice to see that change. having said that, it is really true that there's even a considerable number of people who may or may not be very comfortable using the devices, the apps, in the hands of their own, right, to answer the questions and so on. So there I feel, still telehealth and telemedicine can still be a benefit to provide an equitable care, healthcare itself. The way I think we could also evolve this is to have these kind of middleman piece back, right? And the middleman could be the PHC, the primary healthcare center, or the community healthcare center. Now you can think about these places as being more empowered, because they're not just limited to the one doctor serving the 1,000 villages concept, right? Now the same PHCs are now able to access the experts, or the best of the experts in their own specialization, in a click of a button type of thing. So I feel the PHCs can now be more empowered with the telehealth and the point of care devices that's needed to make this sort of end-to-end extended hospital possible. So I think in the future, combination of telehealth, the point of care devices, and the AI bit can actually improve the healthcare distribution and the non-equity that we have today, or at least till now. And enable really sophisticated healthcare possible even at the nooks and corners of India, and that excites me a lot, right? That I think is a super good future for India that we wouldn't have perceived otherwise.
Great. So basically, between both of you, what you've said is that the tariffs should be consistent, reasonable. The economic side of equity is very important. The socio-cultural equity also comes into play here. The Joint Commission has said that the user interface of these systems should be comprehensible to a 5th grade student. So sometimes these sign-up requirements are cumbersome. Sometimes the user interface is extremely clunky. Sometimes a lot of downloading of apps has to be done. So you spoke about the middleman. I think there's another middleman required here, a virtual care chaperone, what we were talking about as we started. Like the reception, like the reception or the information desk in the hospital, we should have a virtual care chaperone also who can provide, help us provide the digital access to those patients who are technologically handicapped. And I think another point which you brought about is technological equity, which is related to internet penetration, which Amit spoke of, which is only 38%. Of course, it is growing very fast. Smartphones are also growing very fast. So this kind of equity also has to be kept in mind. And with that, we come to the other point, which is privacy. So Amit, how important do you think privacy is as a vulnerable piece as telemedicine moves forward? Amit.
Telemedicine players like Dr. Insta are far more secure in terms of keeping patient records than your own doctor's office could be or would be. We at Dr. Insta use double encryption on both the client side as well as the server side. We are HIPAA compliant, although India doesn't follow HIPAA, but US has developed this gold standard when it comes to privacy and confidentiality of the information. So they are as private as they can get. Can you break the bank? Yes, you can, but it's very, very hard. So same thing applies to encryption and data privacy when it comes to telemedicine as well. It's far more difficult to break the encryption here than the records which you would find at the doctor's office of yours. So patients or the users don't have anything to worry about when it comes to privacy or confidentiality of the doctor-patient consultations or their patient records, which are saved at, again, super secure electronic patient record management module at Dr. Insta. And going forward too, I would think that we would keep on innovating, we would keep on devising new ways to keep the hackers at bay who are looking for this information. And so net, I don't think any people have to worry about privacy issues with Dr. Insta or any of the other leading telemedicine companies out there in the world. So I hope it answers your question, Pavan, when it comes to privacy.
Excellent answer. And I would like now Dr. Satish to amplify this.
Go ahead. I take it in a let's say mixed way. So this more of behavioral economics here. So whenever something new happens, we always tend to find maybe this is dangerous, or this is, let's say, is going to be scary, or this is going to steal away something. But the analogy of fintech, I think, more of us are worried about, somebody stealing my money than my patient record or my, health record. But if you see, most of the banks, including India, are digital and are catering, through the digital platforms, which tells technology has come to that level where data can be stored securely, can be shared securely, as well as can be analyzed securely. But does it say that, we have arrived at a technology level where privacy is no more an issue? I don't agree with that. There are still rooms for improvement. But if you think of technologies like, let's say, federated learning or blockchain, they definitely add to the added security of like encryption and the other security practices, whatever we have. So two basic parts, I think, telemedicine providers should take care of is they have to abide by the law of the land, and the regulator has got a responsibility to define what is healthcare privacy. And a very good part from Government of India is they have recently published, I think last week, as part of the digital health mission, what is the privacy rules. So the Government of India itself is defining a PHR centric or a patient health centric, which can be tied to your Aadhaar. And the patient should be owning the data, which would be acting like UPI, as it actually revolutionized fintech in India, like Paytm, PhonePe. Same way, there would be a healthcare UPI equivalent, which is in the works. So government is actually working on that UPI framework equivalent for healthcare, interoperability standard, which is a very big boon for people like, let's say, Amit or any other, aspiring telemedicine practitioners. So I think here that the government has taken a proactive step, and also the technology is available, which is at a very quite mature stage now, which can be leveraged to ensure privacy. And third is, this is not compromisable. So all the telemedicine providers should be looking for privacy as a default or hygiene option as they are catering to the patient's needs and, other needs. One important thing, it's very important to understand now, which we also came together as well as scientists, is during Corona, the future wars are going to be more biological and more cyber. So, it is predicted that the future war is going to be cyber biological. And then, your healthcare data becomes extremely important. It is a national security issue. So the telemedicine startups should be adopting to the law of the land. But I would also encourage the naysayers that, by telemedicine, you would be compromising on privacy. No, the physical medicine is also not so robust on privacy matters. And the telemedicine platforms are much better in privacy compared to the physical medicine, counterparts. So we need to have a cautious optimism for privacy. And there is a responsibility from each one, from the patient, from the doctors, from the telemedicine providers, from the regulators, and from the technologists. If they all work together, this is going to be a very good, optimistic future. That's what I feel.
Great points. Great points. In fact, you have brought in another angle. You have said that healthcare is getting geopolitical importance. Yes.
Yes.
Today, a pacemaker can be hacked, or its battery downloaded, or shocks can be given. That means pacemakers have moved into the defense space. And so that is why privacy is important. And the fact that if actually the data, how large it is and whose hand it falls in is the problem. So if it hands, the experience says that if it lands in the hands of ill-meaning politician, you can lose your freedom. And if it lands in the hands of ill-meaning business, for example, an insurance business, then they can utilize that to increase your premiums, this and that, etc., without by indiscriminate knowledge of your data.
Yep.
And if it can be made aggregate and anonymous, and then this data if shared with businesses or politicians, it does not make us more vulnerable. And third point which you brought in is that this is a technology problem. Why privacy issues are coming? Because you have the technology to store all that data, and technology itself is bringing a solution, for example, blockchain, etc. Great points. So I will have to now come to the questions, because the questions which are coming are very intelligent. They are coming from CEOs or CXOs, so I will not go for that as designation. Let me start with what we have got from Amitabh Jain. And let me ask Geetha this question. Some of the tech solutions can be done for physical meetings, such as history taking, AI assistance in diagnosis, etc. So will that necessarily help in telemedicine, or how it can help in telemedicine, or is it already helping? Geetha.
Sure. So definitely there is a lot of technology available in digitization of health records itself. So for example, earlier records are, mostly are paper in nature, right? Or it could be like a mammogram or an ultrasound of an image that you've taken 10 years ago, 5 years ago, 2 years ago, 1 year ago. So the doctor wants to see all of it together. So the digitization technology, not just scan and upload, scan, OCR and upload, that's been around for, like, from a BPO standpoint. I think that can actually sort of come back in a more meaningful way, because we're not just talking about scan and upload, understand what is being scanned, that the tool has to understand, and then give it as a meaningful input to the doctor, right? So that definitely, can come in a long way. I'm sure many of the telemedicine applications will start supporting this as a useful way of creating the patient side, health records that we talked about. Definitely that can be used, and that has been used earlier in the hospital setting, and now can definitely be used at the patient level, even at home, thanks to the smartphones and very super resolution and cameras that are available in the smartphone today.
Okay. Coming now to Amit Munjal with the next question, which is coming from Prabal Chakrabarti from CII, Himanshu Sharma from Zydus Hospitals, and Swapnil Lime from MyDia. They're all leaders. So the question is, would patient behavior go back face-to-face consultancy when normalcy returns? So this is a question which you would have surely pondered, because your business is based on this platform. What is it? What is your view, and what is the basis of your view, Amit?
So my view is that you have two sub-segments. One, a sub-segment which constitutes of current users of telemedicine. And then the second segment is the users which have not used telemedicine yet. So if you look at the sub-segment, which is the current users of telemedicine because of Corona or even prior to Corona, clearly because of Corona, the current users' numbers have increased multifold. Like, for example, at Dr. Insta, our telemedicine consults from pre-Corona times to now have increased by little less than 400%, so 4 times the volume. And then there is a larger segment of the population which is yet to embrace telemedicine. They get to hear about it from their friends, family members, extended circle of acquaintances, but they are yet to jump on the bandwagon and use telemedicine. So for the current users of telemedicine who also are accustomed to going to brick and mortar hospital, just because they're at the very peak and they don't have access to brick and mortar hospitals yet because of contagion risk, the number would go down. But there would be an avalanche of the new users or new adopters of telemedicine, which would more than make up for a bit of loss of the current user proportion. So net, if let's say 5% of the population in the country is using telemedicine at this point of time, this 5% population may come down to 3.5% once Corona goes away. But out of the remaining 95%, even if we get 10 more percent, the net volume would go up. So the new normal for telemedicine is going to be far higher and far bigger than it has been ever in the history of modern India.
Great point. What you're saying is the genie is out of the bottle. It is very difficult to introduce something that people and clinicians like and then take it completely off the table.
Not just that, you know, the mindset has changed now of the government toward telemedicine. Principally in the past, the government would provide all kinds of support for telemedicine, but now they are like pushing it more and more across the board so that it becomes mainstream sooner than later, more so in a country like India, which has one of the worst doctor to patient ratios. And then even in bigger cities where there is a higher concentration of doctors, people have to deal with all kinds of logistical issues to get to a doctor, losing out on productivity. Not just that, the third push is also coming from the CXOs of the large companies. In the past, we would get around 50 to 70 requests from the large companies' HR departments, comp and ben departments, saying that, listen, we want Dr. Insta to be rolled out across our 10,000 employees all over India or 50,000 employees all over India. Our requests have gone up by 10 times, where the CXOs are reaching out to us saying that, listen, this is the best thing that we can do to our remotely by offering them telemedicine solution. As an employer, we are happy to pay. Our employees would be using telemedicine for themselves as well as for their dependents. Net, it will improve the productivity. It will reduce the medical absenteeism across our employees, and our employees would be happier, healthier, more productive at the end of the day if we roll out a telemedicine solution for them. So this mindset, this boardroom conversation that is happening as we speak about telemedicine, it's never going to go back to the pre-corona levels.
Amazing. Basically, you're saying this omelette cannot turn back into eggs. And another reason for that is this B2B avalanche of demand which is going to come. Anything you'd like to add to that, Dr. Satish?
Yes, I think I will just add to what Amit said is, two groups of users, if you will see. One are the millennials, and they hardly, visited the hospitals, and they, registered any physical interaction, as you said earlier, right? They preferred talking to a phone rather than, having a physical interactions. As they have experienced healthcare now through this COVID era, they have tested that, telemedicine can be done and it can be trusted. So those people are a big convert zone. When it came to those people, let's say people like, 35 plus or 40 plus, who were more frequent visitors of the hospitals, and they were used to the physical interactions, but they never trusted in telemedicine. Now, as they have tested telemedicine, and yes, this works and this can happen. So I think a large number of them also got converted. So it's like, I always call this as a Jio phenomenon. As Jio started the free service to take on Airtel and Vodafone. And as people experience the service first and the benefits of it, after that, they got a lot of conversion. Same way COVID has made this Jio moment for all the non-telemedicine users. So they experienced it. And after experiencing it, all those non-trust issue, whatever they had, it has gone to, their trust. They have started trusting it. So the numbers are always going to be higher. I would expect majority of the non-urgent care are going to happen over telemedicine. So let's say vaccination of a kid, or asking for whether I should continue my medicine or not, when to stop my medicine, physiotherapy, mental health, sexual health, dermatology issues, and many things which can be done without visiting physically a doctor. Mostly after experiencing it firsthand, those people will be converting. So it will stay actually in the long run. So it is not going to come down. That's what I say.
Excellent point you have made. You call it the the Jio moment.
Yeah.
So I was reminded of that घड़ी detergent ad. पहले इस्तेमाल करें फिर विश्वास करें और
Exactly.
कोविड ने इस्तेमाल करवा दिया. अब
Yes.
विश्वास हमें हो गया है कि हमें डॉक्टर से डायरेक्टली डिजिटल इंटरेक्शन बेटर है, for many indications. Great point. Geetha, we would like to round it off with you, and of course I'll ask the others also to step in after that with this last question. What are the what do you think is the ecosystem which you require for telemedicine to grow? So one of the things which has come out is this one: public awareness and experimentation, geo model. Okay. The other thing which has come out is user acceptance. What are the other 3-4 points in a generic manner which you need for telemedicine to grow? And then I'll come to Amit and Satish.
Yeah. So, like I was alluding to earlier in one of the questions you asked, right? Telemedicine is going to be the starting point, right? I guess it's, my guess of the future is that this is going to be the strata in which all the digital health can be delivered. So in order for that to happen, right, users should be able to do as many diagnostic tests, because everything has to be data-based, as many things as possible closest to their homes, if not at their homes, at least closest to their homes. And so the point of care devices need to be there as much as possible, the triaging devices and so on, that need to be there. Ability to have this data from different teleconsultations in one place, the consolidation, and the recent government notice on the digital health ID and all is a wonderful step towards that. That coming together, the platform being stable and secure and trusted, then these devices giving the data, there is no stopping. This will become an inevitable way of delivering health in future, according to me, as long as these things are fixed.
Great points. Dr. Satish, what would you like to add to that? She has spoken about the regulatory policy, foresight, platforms, thoroughness. What would you like to add?
There is very little to do. So just to add on it, so I put it always as patient participation is very important to drive this, and which has happened to some extent, through this Geo movement. And technology is very, very important, but I think the onus lies with the technologist also, or the telemedicine providers also, to keep it intuitive. So we never got trained for a Google or a Facebook or an Amazon or a Flipkart. So same way, I think, it cannot be expected for people to get trained to use a, telemedicine solution. That's where, I, don't agree with Geetha on the middleman part. So technology should be playing that middleman part also to make it very, very intuitive. That's the responsibility of the telemedicine solution providers or the solution makers. Third is, I think the hospitals, which are the providers, had this, let's say, lock in their head that, it has to be a physical or infrastructure-based 500-bed hospital, 1,000-bed hospitals. But healthcare is actually wherever the patient is. And most of the patients live outside the hospital. So it's a mindset change also for the hospitals, which has started now through telemedicine. They can cater to a larger mass than only the beds what they cater to. When it comes to regulator, I think they have got the largest role to play. And I think, we are participating into that digital data health mission blueprint, which has come out, and government has been also proactive, but it could have been much more proactive. So we could not have, or the regulators could not have waited for COVID to allow telemedicine as a legal entity. Before COVID, many people would not have understood, but telemedicine was not a legal service. It was not a legitimate service. Let's say in Karnataka, you still could not have practiced telemedicine. There was a high court order in Maharashtra where you cannot practice medicine over WhatsApp, and there were so many restrictions. And I think regulators didn't have a very good certificate when it came to that COVID has to push them to open up telemedicine, whereas telemedicine could have been opened as a legal service much earlier for a country like India. So I think when patients, providers, payers, technology, and regulators work together for the ultimate benefit of the patient, this is one thing which is very important. If the goal is for betterment of the patient, then everyone is making money. Then the system stays sustainable. If anyone is saying that, I am having a skewed power or an unnecessary power and I can extract from the system, then the system doesn't grow sustainably. So I would feel this is responsibility of all. This is a all win kind of a situation. There is no one here is losing. The pharmaceuticals are going to benefit, the medical device manufacturers are going to benefit, patients are going to benefit, payers are going to benefit, the hospitals are going to benefit, government is going to benefit. So I see, little should actually stop us achieving this digital health journey if all of us come together for the larger good, which is betterment of the patients.
Excellent point. And you're right, the technology should be intuitive. And just to complement that point from Geetha's side, perhaps Geetha was meaning that that there are the lowest of the low in the technology acquaintance space. For example, in advertising, when I was in advertising, I came across tribes which did not know how to climb stairs, or they did not know how to put on the electric switch or put it off. So maybe from that point of view, but the beautiful point which you have brought in is, and this rarely happens, that everybody is winning. When Henry Ford brought his assembly line, the workers won because the number of hours came down, their wages went up, and the cost of production also came down. That was the biggest hit to communism, the logic of communism, because everybody won. And you have also beautifully brought up the point, everybody is winning through telemedicine. And that means it will be a very inclusive push and blessings it will get from all the communities. Great points, Dr. Satish. Amit Munjal, last word. What is it that you would like to add to the points which Dr. Satish and Geetha have made, where Dr. Satish has just added user acceptance?
Geetha and Satish have covered most of the points that I could think of. One thing where India is a bit notorious is dispensation of medicines without patients showing proper prescription at the pharmacy stores. So India has around, little less than 1 million pharmacy stores. And at almost all of them, you can just show up without any prescription and get whatever medicine you want. Although there are laws in place that these medicines, prescription drugs, cannot be dispensed without having a proper prescription in the possession of a buyer or a patient in this case. But yet the abidance to that law in India leaves much to be desired. And then that's why almost anyone can get almost anything from these pharmacy stores. And this is such a bad thing for the overall long-term health of the patients, where the patients can just walk in and get the strongest of the antibiotics from this not so informed or educated attendant who is not even a B pharma or D pharma or having any kind of medical knowledge or education. Won't inquire, are you allergic to any medicines, but would still give you the strongest of the antibiotics for your mildest of the problems, making you more and more resistant to those medicines, such that if the need arises for you to take those medicines, they won't work as efficiently, as beneficially as they would have otherwise. So this practice has to stop, and even the most educated people in our country are guilty of walking into these pharmacy stores and asking the attendant, "Bhaiya kya do?" And then that mindset has to change. And when you ask these most educated people that why are you asking this attendant who doesn't know jack about medicine as to what you should take for your own body, they say, "Oh, because I don't have time to go see a doctor." And telemedicine and the formalization and the adoption of telemedicine in pan-India would change that mindset. If you go to, CVS, Walgreens, Rite Aid kind of pharmacy chains in US, they have a separate section where they have put these, monitors and screens where you can just sit and via telemedicine, you get connected to a doctor on the other side and you can get a formal proper prescription that you can now get fulfilled through the same pharmacy store. So here in those situations, you are not taking unnecessary medicines. and you're not at the beck and the call of the attendant who is at the pharmacy store. So telemedicine adoption should drastically change that, but the law also needs to be tightened both for the user who doesn't have a prescription as well as more so for the pharmacy store which is dispensing these medicines without caring about the long-term ramifications on the health of this buyer or patient in this case.
Great point. So basically what you have said, that uniquely in India, the doctor saab will get competition from chemist bhaiya, in the telemedicine space also. So basically, I think the entire panel has been so thought-provoking and so thorough in its discussion. What we are concluding here is as far as the future is concerned, what telemedicine requires is public awareness, user acceptance, business models, a reimbursement policy, which Amit, you also spoke of earlier, policy foresight and thoroughness, and implementation of the laws and intuitive technology. So given these tailwinds, telemedicine can surely soar enduringly. And on that note, I thank you all, and I thank all the audience. In such large numbers, you stay with us even when we cross the time limit, which we often do because of the questions and because of the content of the discussion which is happening. So thank you very much, audience, and I will pass it on to Siddharth.
Thank you very much, sirs and ma'am. Our leaders and I have taken home so many nuggets from the conversation today, and very well moderated, Mr. Choudary. We've thoroughly enjoyed and learned a lot. I'm still receiving positive messages from our leaders on our WhatsApps and our emails. So thank you very much. While a lot of the questions have been covered wonderfully and has given us a well-rounded idea of the landscape, we've also received specific and focused questions which may require a longer and one-to-one discussion between the leaders in the audience and experts. And we would be very happy to fix meetings between you and our pool of experts in the healthcare domain and other domains as well for mutual benefits. So thank you once again, and thank you to our attendees for staying till the end in large numbers. Whether you would like to engage with us through our expert panel or as learners, you're invited to connect with us for membership. We're soon launching our digital platform exclusively for business leaders, and we will be sending out invitations to the first 1,000 leaders across our 4 sectors, which are healthcare, e-mobility, energy, and real estate. So thank you very much, sirs and ma'am, and thank you to the audience for joining us today.
Thank you very much.
Thank you, Siddharth.
Have a great evening.
Thank you, Pawan. Wonderful moderation.
Thank you. Bye.